So good afternoon. I am Vince Bonham, the Deputy Director of the National Human Genome Research Institute. I'd like to welcome you to the NIH Genomics and Health Disparities Lecture Series. The first lecture was held in May of 2015. And we're now entering our near 20th lecture. This series aims to highlight genomics and health disparities research. In addition to the National Human Genome Research Institute, the lecture series is co-sponsored by the National Institute of Minority Health and Health Disparities, the National Heart, Lung, and Blood Institute, the National Institute of Diabetes, Digestive, and Kidney Disease, and the Office of Minority Health and Health Equity at the Food and Drug Administration. Speakers have been chosen by the series co-sponsors of interest to the NIH community and the FDA community, and focused on genomics, health equity, and biomedical research. All lectures are available on genome.gov to watch the recordings. We are pleased to have Dr. Alondra Nelson joining us this afternoon, and my colleague, Dr. Eric Green, the director of the National Human Genome Research Institute, will introduce Dr. Nelson. Dr. Green.
Well, thank you, Vince. And it is truly my pleasure to introduce Dr. Alondra Nelson. Dr. Nelson currently serves as the inaugural Deputy Director for Science and Society in the White House Office of Science and Technology Policy. In this role, she explicitly brings social science expertise, including attention to issues of social inequality, into federal science and technology strategy and policy. Dr. Nelson is also the Harold F. Linder Chair and Professor at the Institute of Advanced Study, an independent research center in Princeton, New Jersey. She was president of the Social Science Research Council, an international research nonprofit from 2017 to 2021. And she was previously professor of sociology at Columbia University, where she also served as the inaugural Dean of Social Science. Dr. Nelson brings a career that began academically on the faculty at Yale University. There she was recognized with the Poorview Prize for Interdisciplinary Teaching Excellence. Dr. Nelson's major research contributions are situated at the intersection of political and social citizenship on the one hand, and then emerging scientific, medical, and technological phenomenon on the other hand. Her work explores science, medicine, and technology as sites of both risk and also empowerment, especially for underserved and vulnerable communities. She connects these dimensions in a range of widely acclaimed and award-winning publications. These include the books Genetics and the Unsettled Past and The Social Life of DNA. Dr. Nelson is a member of the American Academy of Arts and Sciences, the American Academy of Political and Social Science, the American Philosophical Society, and the National Academy of Medicine. She is no stranger to NHGRI. Dr. Nelson's a former member of the Genomics and Society Working Group of our National Advisory Council for Human Genome Research. And that working group provides valuable advice to the Institute on both short and long-term planning and priority setting at the interface of genomics and research activities that the Institute conducts. So we welcome her, we thank her, and after her presentation, my colleague Vince Bonham will facilitate a discussion. But now please join me in welcoming Dr. Nelson.
Thank you, Eric. It's great to see you. Thank you for that warm welcome and for that introduction and for your leadership of the National Human Genome Research Institute. Let me, of course, acknowledge Vince Bonham, a longtime friend and colleague of mine. Congratulations on your recent appointment as acting director of NHGRI. Your voice and your values have been a guiding force in the work of standing up this new Office of Training, Diversity, and Health Equity, and really keeping health equity and equity issues at the center of certainly of genomics, but and at the center of the work that we do and have done for many years together as an intellectual community. So thank you for the invitation to be with you today and to have been your colleague for many years. So I bring with me greetings from Eric Lander, the director of the White House Office of Science and Technology Policy, who's no stranger to any of you here, is a longtime leader in mapping the human genome. And Eric knows as well as anyone the importance of genomics for cracking some of our toughest challenges and unlocking new and powerful opportunities. So greetings from Eric. And then finally, let me just acknowledge and thank the larger NHGRI and NIH community. As Eric said, Eric Green, not Eric Lander. This is NHGRI is really my home at NIH for many years, and I've been fortunate to count many of you as colleagues and thought partners over the years. And I'm really now so honored and pleased to serve alongside you in government. So I'm grateful to be speaking with you today as a colleague, as I said, and as a representative of the Biden-Harris administration and the government of the United States. I spent most of my professional life in the academy, and my case studying the intersection of science, technology, medicine, and our social fabric. Exploring what I call the social life of DNA, the ways that the double helix can help us understand who we are, and the social questions our genetic code leaves unanswered. Investigating how science shapes the world we inhabit and how societal context shapes science and technology has really been my life's work, as well as studying through the prism of the sociological imagination, the relationship between reason and freedom, as C. Wright Mills put it 6 decades ago. So it's really this work and those experiences that have forged the perspective I bring to public service, the conviction that science and technology must be a tool to make lives better, safer, and fairer. The conviction that innovation can open the door to a fairer future for all people. These past 8 months, as I've served in the halls of government, I've witnessed these ideas come to life. And I've seen that democracy, like science, like research, is a process, never quite realized, never quite finished, but always striving to perfect itself, pulling us ever closer to our highest ideals as researchers, as citizens, as members of the public, and of a global society indeed. And yet never before in living memory have the connections between our scientific world and our social world been quite so stark. And never have they existed in such profound tension. We see this in the unprecedented access we have to data that tells our stories in bright and vivid colors, data that can be marshaled to make life easier and more just. We have powerful technologies from genomics to artificial intelligence, tools that can help us answer important questions about who we are and what we want to do in the world, tools that are right at our fingertips. But too often, these data and the algorithms that we use to harness them are plagued by bias, unchecked and unregulated and programmed to exclude. Too often, they are developed without regard for their real-world consequences and without the input of the people who will have to live with their results. We have the tools to cure disease, to prevent human suffering. But too often, those tools are out of reach. A trip to the hospital means facing discrimination, an insurance plan that doesn't cover one's treatment, or a doctor who simply ignores one's pain. The title of this talk is From Peril to Promise, and that's the heart of this tension, the essence of the journey that we're trying to walk together. These are the problems we face, injustices that are unfolding in the lives of the most vulnerable around us. And it falls squarely to each one of us to help solve these problems. Because you see, when we have the ability to alleviate suffering, but don't, that's not a failure of science, it's a failure of imagination. And when we can break the bonds of oppression and marginalization, but choose not to, that's not a failure of engineering, it's a failure of conscience. That, I think, is the beauty and the burden of this moment. And what we do now, how we resolve these tensions in the context of a pandemic during which they've become so stark and we have learned so much, what we do now is a referendum on us, a question of who we are and who we want to be. These questions are really at the core of our science and technology policy vision in the Biden-Harris administration. We're building a science policy that sees solutions through the eyes of the vulnerable and sees innovation through the lens of those who have been most damaged by it. We're fighting to get technological development right, to bring that development out of the shadows and into public view, and to situate it in our values of equity, accountability, justice, and integrity. This is the roadmap to restoring trust in the institutions of government and science and in one another. We are not the first administration to confront this challenge. 75 years ago, in another period of turbulence and upheaval, President Franklin Delano Roosevelt sent a letter to his science advisor, asking how the United States could accelerate scientific research in the years that came after World War II. The answers that came from that letter made way for some of the most important discoveries of the 20th century. President Biden has been very clear. He has said, we can do this again, and we can do more. And we're already on our way, already making meaningful progress powered by the engine of American innovation. It is in the laboratories and libraries of this country that some of our most audacious goals take shape. And it is in the corridors of innovation that new solutions spring to life. It is in the minds of some of our nation's best and brightest that new ideas are born. And in the everyday work of government that we must bring those ideas to bear to meet the historic challenges of this moment and this generation. The White House recently took a major step in that regard. We laid out our research and development priorities for the upcoming budget year. Budgets are moral documents. They are documents that tell us about the world that we want to live in part. These are priorities that will guide all of our executive departments and agencies moving forward. This is the annual budget memo, R&D memo, developed jointly between the Office of Science and Technology Policy and the Office of Management and Budget. And it is and embedded in this document was a challenge really to every part of government. It called on agencies to confront the health crisis at hand by protecting Americans during this pandemic and shoring up our defenses in preparation for the next one. This means building out early warning systems, accelerating new therapeutics and treatments, and creating a more inclusive, caring, and effective public health infrastructure. It called on agencies to tackle the climate crisis now by transforming our clean tech infrastructure and investing in resilience in our most climate vulnerable communities during this narrow moment of opportunity for transformation. It called on colleagues across government to create the conditions for new research to emerge, from biotech to computing and beyond. Research that boosts American jobs and that protects American security. Research that renews our leadership and makes us more competitive across the world. Finally, this budget document directed every part of our government to support innovation, not just for the sake of novelty, but for equity, innovation for equity. To pursue R&D investments with an eye toward people who have been historically marginalized, excluded, and ignored. And to make sure that new research, new information is accessible to all people and all communities and benefits all people. This last pillar is at the heart of our science and technology strategy and this Biden-Harris OSTP, innovation for equity. That is the ethic that informs each of these critical steps, helping to make our country healthier and safer, more livable, and more prepared for what may lie ahead. But none of this is happening in a vacuum. All of it follows the whole of government agenda that President Biden set in motion on his first day in office. Within hours of his inauguration, the president signed an executive order directing every branch of government to root out racism in federal programs and institutions. And within days of this, another presidential memorandum that ordered us to work together across government to help restore trust in our work. As part of this work, the president stood up the Equitable Data Working Group to make sure federal data reflects the diversity of America. A few days later, when he launched the Scientific Integrity Task Force, he tasked this body with safeguarding science and technology against political interference and embracing evidence-based policymaking. And in the tradition of FDR, President Biden sent his own letter to his own White House science advisor, my colleague, Dr. Eric Lander, laying out 5 guiding questions of and for this moment about the relationship between science, technology, policy, and society. Our work is to answer those questions, including the one that so many of us have wrestled with in our research. How can we guarantee that the fruits of science and technology are fully shared among all Americans and all people? This question, the 4th of the 5 questions the president posed to Dr. Lander, is the foundation of the OSTP's new Science and Society Division, which I have the immense privilege to lead. And answering this question begins with honest and open conversations about the past and the present. It begins with telling stories and accounts that for too long have lingered beneath the surface. Many grew up hearing those stories of forced sterilizations in Puerto Rico, in California, and the southern United States, as well as the horrific Tuskegee syphilis experiments. Stories of Black and brown bodies degraded and disrespected, made sick and sometimes even killed by the very people charged with their care. So it's no surprise that some people in our national community have misgivings about science, about technology, and about science and technology policy. It's understandable that over generations, those misgivings have calcified into distrust. The civil rights activist Fannie Lou Hamer put it best in 1964. Many are simply, she said, and quoting her, sick and tired of being sick and tired. But in the work of the Biden-Harris OSTP, we're not just reckoning with the distant past. In recent years, the bonds of trust in government and in science have worn thinner and thinner, a decay and erosion that has accelerated over the last 4 years. We need to confront that more immediate history as well. Since May, the White House has been engaged with federal scientists, career professionals who staff our government agencies from one presidential administration to the next to better understand what happened over the last few years and to restore integrity to our scientific processes and to place trust at the center of scientific research and technological development. The presidential memorandum that I referenced on scientific integrity asked OSTP to convene a group that would review scientific integrity policies across agencies and to identify effective practices that could help make them open, make science as open and trustworthy as possible, from the conduct of researchers to the way that scientists communicate their conclusions. And our work has been well underway for several months as we now prepare, I hope in the coming days, to release the report of the Scientific Integrity Workforce, the first ever such task force in government in American history. And I want to pause here to acknowledge Dr. Chris Markham from the NHGRI community, who was a leader of one of the important subcommittees of the Scientific Integrity Workforce. So in our work on scientific integrity, we reviewed policies and practices across agencies, rules and guidelines on conduct, communication, and the use of research, and the measurement of their effectiveness. Between listening sessions, our requests for information, and more than 1,000 people, between listening sessions and our requests for information, more than 1,000 people from across the United States and throughout government had an opportunity to share their feedback and experiences with the task force. This was an unprecedented level of engagement around the issue of scientific integrity, one that we hope to continue. And we will continue also to take extra care to foster dialogue that is open and inclusive and deeply deliberative around this issue that is so central to restoring trust in government. The task force was comprised of nearly 50 people from 29 federal agencies who reflected the diversity of the nation and brought a variety of perspectives: scientists and statisticians, engineers and political appointees, lawyers, and policymakers. The members of the task force represented a diversity of agencies, regulatory and non-regulatory, those that conduct intramural research and those that fund extramural research. Agencies known for their use of science and others that are just beginning to integrate science and technology into their day-to-day work as we move to become a more evidence-based policymaking organization. The engine of the task force work was engagement, as I said. And let me tell you a little bit about what they heard. We heard from the American people that they are concerned about the conclusions that come from government science. We heard that they're invested, the American public, perhaps more than ever before, and ensuring that the decisions of their government are guided by the best available science. We heard thoughtful and innovative ideas about how we can improve our scientific integrity policies and the implementation of them. And we'll be highlighting a number of these good ideas in the task force report that is forthcoming. Restoring trust in government has implications for everything from climate policy to vaccine uptake. Whether people are challenging policies or rallying around them, they must always have access to the facts. Our strategy has been to be honest about the past, to show our work, to be transparent, and to push others to do the same. We are all aware that this hasn't always been the case in recent years, that there have been lapses in scientific integrity, including and some very public examples that have been widely covered in the press and elsewhere. These are issues that demand our concern, our attention, and our energy. What we know and what we must keep in mind as we craft policies for the future is that scientific integrity extends well beyond science and scientists. It's not just about ensuring that scientists adhere to professional values and practices in their research, although of course that is essential. It's also about protecting science and scientists from political interference, from all inappropriate interference. And it's also about preserving the bond of trust between scientists and technologies and government and the American public. And it's about ensuring that the work that we do and government is truly guided and informed by evidence. So it's critical, of course, that agencies like NIH, like NASA, like NOAA, traditional pillars of our science infrastructure, are engaged in the work of scientific integrity, but also other departments like the Department of Justice, the Department of Transportation, and other organizations, departments, and agencies in government that also deploy science and technology-based tools across their work. In addition to the public and to scientists, we need to engage everyone who communicates about science, who makes decisions based upon it. While most science agencies have policies already in place, we're helping to recalibrate these policies to key issues of our time. There is a kind of modernization, harmonization, and updating that should take place. And a few of the sort of new and forward-looking things that the presidential memorandum called out, I want to be sure to mention because I think they're important for how we are refreshing, even as we're reaffirming how we think about scientific integrity. These include supporting equity and representation in the scientific integrity process, helping to support the workforce of the future, and making sure that every community has access to the fruits of scientific development and research. It includes thinking about new and emerging modes of science participation, such as citizen and community-based science, which have tremendous potential for strengthening and building public trust in science. And it has also to do with addressing issues related to the growing use of AI and machine learning across the federal government. With this in mind, we also need to acknowledge another major force causing people to lose faith. Technology, which for all its promise, has given more people more reasons to be distrustful. That's why we've been listening to a wide range of stakeholders on the impact of emerging technologies on the Scientific Integrity Task Force and in other OSTP policy planning processes as well. We've endeavored to bring to the table people and communities who are rarely in the room when where devices are programmed, algorithms are written, and inputs are made, but who live with the outputs nonetheless. And we've asked those individuals to share their experiences with the White House. We're talking to a wide array of groups, a cohort that represents the diversity of lived experiences in the United States. And despite this diversity, there has been a kind of striking consistency to the responses. Time and again, we have heard from people who have fallen victim to discrimination at the hands of artificial intelligence and machine learning, including immigrants who've been automatically sorted out of job applicant pools with no way to seek recourse, people of color and working class members of working class communities whose applications to apartment rentals have languished in cyberspace. Story after repeated story of Black men arrested and jailed after being misidentified by predictive policing tools. Injustices can be baked into technology by negligence or even by design. So we are thinking about STEM, we were thinking about inclusion and exclusion in technology and the federal workforce, and as well as in the larger STEM ecosystem. We launched recently an initiative called The Time Is Now to investigate issues of equity in science, technology, engineering, math, and the health sciences. We've been working with others to identify structural barriers facing people in the STEM fields, including those who have disabilities or those who are immigrants, people without generational wealth, and others who began the race to their careers far behind the starting line. The Time Is Now was a 5-part roundtable series that invited researchers, thought leaders, and advocates to the table and closed sessions with OSTP to diagnose endemic issues and suggest informed solutions to ensure that all people can thrive in these fields if they choose to enter them. In this process, we've learned a great deal from all of these candid conversations with scientists, with communities, with advocates and professionals. Above all, these discussions have laid bare a vast architecture of discrimination, an edifice of inequity and inequality that has only grown steeper and more overwhelming. We recently completed the second phase of the Time Is Now initiative, an ideation challenge that enabled OSTP to solicit ideas about advancing equity in science and technology directly from the American public. These efforts dovetail with your Unite initiative at NIH to end structural racism within the NIH-supported and greater scientific community. And I hope that people in today's audience will be our partners by sharing their evidence-based best practices and highlighting people who are champions of equity in STEM and providing suggestions that might help inform OSTP's policy recommendations. So all of these engagements with the public, from scientific integrity to the more recent STEM equity engagements, are really to be followed up with commitments. So it's not just conversation. We hope to spur strategic action across public, private, and nonprofit sectors, including and working in partnership with government to really shake the foundations of inequality and inequity in STEM and elsewhere, and to open up opportunities across sectors. We have learned a great deal from all of these candid conversations. But above all else, these discussions have told us that there's much to be done in this moment. Crisis can confuse or it can clarify. The recent pandemic has showed us problems whose depths many had not seen and pointed to where interventions were badly needed. A government truly in service to the American public must confront these structures head on. And this is what we're endeavoring to do in the Biden-Harris administration. We've been taking bold and necessary steps that I've described this afternoon to restore trust in government and in science. And that means building on important progress achieved during the Obama administration with platforms like data.gov, publishing full data sets and making them available to researchers and to anyone who wants to use them. Our scientific integrity roundtables and engagements made clear that now is the time to inject new energy into that work of transparency and of open government, to insert new urgency into making sure that the public can always see where data comes from and can draw its own conclusions. This means that sometimes people will disagree with the decisions that government has made, or sometimes they will interpret data differently. That is not something to be fearful of. It is the sign of a healthy democracy. Restoring trust in government and open government has implications for everything from climate change to the participation in clinical trials. Whether people are challenging policies or rallying around them, they should always have access to the facts. Alongside this effort, we are taking action to make sure that the facts, that those facts reflect the stories and experiences of all Americans. This starts with collecting data in a way that is fair and equitable. In my work in the administration, I hear people at every level ask critical questions about what our decisions will mean for different groups and about how we can do our work most equitably. For example, how might one policy or another affect Black Americans in urban settings differently from Latino farmers in rural areas? Critical questions that for decades I only ever heard in the academy. Unfortunately, federal data is often not broken down by key demographic variables such as race, sexual orientation and gender identity, disability status, income, veteran status, and other critical variables. The work of the Equitable Data Working Group, which I mentioned previously, has been seeking to change that. We've convened a cohort of policy experts, statisticians, social scientists, data scientists, and IT leaders from across government with one goal: to develop a way to measure equity and inequities throughout the work of the federal government. To meet that goal, we've taken a case study approach to the work, focusing our efforts on a set of well-defined questions that have been difficult to answer in the past for lack of sufficient data. For example, what could we learn about labor market cycles if we had a clearer sense of who is and who isn't taking advantage of unemployment benefits? If we knew their ethnicity, their gender identity, if they lived in a small rural community that's typically undercounted. Another example, there are programs across government to address climate-related crises, including in underserved communities. But who precisely are these programs reaching, and who still isn't reaping their benefits? And which small businesses, which communities have accessed the aid promised in the CARES Act, and who still hasn't seen nearly enough help? To answer these questions, we need to disaggregate the data. We need to break it down and lay it out. We need to understand what's missing, indeed who is missing, from the numbers and the stories and the experiences we collect. That information can make the policy design process more equitable and lead to more just outcomes across the board. It, of course, also allows us to do ongoing iterative assessments of the equitable nature or not of the programs, initiatives, and services that government provides. Government still has a long distance to travel in these efforts, but we can get it done by stepping on the accelerator, by shining a light on the experiences of vulnerable groups and amplifying their voices in the policymaking arena, by collecting and sharing data about Asian American, Native Hawaiian, and Pacific Islanders, LGBTQ+ Americans, rural communities, and others who've not been included in the past. We'll soon deliver an initial report to Ambassador Susan Rice, the head of the White House Domestic Policy Council, laying out the barriers and gaps to equitable data and offering some recommendations for how to address them, from promoting data sharing, privacy-preserving data sharing between agencies, to building new data sets altogether that build intentionally, deliberately, and safely attention to disaggregated data from the beginning. Finally, for too long, the moral challenges of new technology have gone, Finally, we are speeding up the process in our work of making recommendations, developing real policies to address real issues in the lives of Americans. For too long, the moral challenges of new technologies have gone unaddressed, and it's time to lay out some rules of the road, particularly with regard to automated digital data-driven technologies and machine learning. It's time to articulate a democratic vision for our use of these technologies. Every free society has guardrails, but we shouldn't be singled out for who we are or what we believe. We should be protected against unreasonable searches and seizures in our day-to-day lives. These protections, even if aspirational, must also carry over into our digital lives. Basic rights and responsibilities for artificial intelligence as a safeguard against abuse, against bias, and against discrimination. Imagine if companies thought about equity at the start of the design process, and not only after issues of discrimination emerged downstream. What would it look like? What kind of society could we have if all innovation began with that kind of ethical forethought? What kind of society could we have if we considered from the very beginning What might happen if a new medical technology or a new digital technology or AI tool fell into the wrong hands? Where the related data might travel, how it might be misused to deepen inequality. These are questions we must ask if we are to build a nation, a world where innovation happens without predation, where protections are baked in from the beginning. A world where marginalized communities have a voice in the science and technology development process, and where designers work hard to ensure benefits reach all people. We've been turning at OSTP to the American people to help us get there. We've been asking folks across the country to tell us about their experiences when it comes to AI and machine learning and other emerging technologies, and to provide their ideas and insights to address these problems, including through a request for information on biometric technologies like facial recognition, through public events and more. And that RFI is currently open and closes on January 15th. So you have almost exactly a month if you want to add your voice. These efforts that I've been describing this afternoon seek to bring ordinary people into the work of government, to close the trust gap that has widened in recent years, and to address the moral injustices of history. That's what's required of us as we face down the unique and complex challenges of early in this century and of this generation. We are called to build a new critical approach to science, technology, and our social lives. An approach that places human beings at the center, a science and technology policy of solutions. We can do all of this. We have it in our power to democratize the tools of science. We can close the vast resource gaps and erase the medical disparities and structural racism that have for too long held us back. We can restore the integrity of public service and renew our commitment to racial justice. Each of us has an essential role to play by continuing to generate research that steps into theories, policies, and practices that contribute to equity and opportunity. So I want to close today with a story you might have heard me tell before, one that represents where we are headed if we get this work right. It is the story of Zayla Avant-Garde, a remarkable 14-year-old girl from New Orleans, Louisiana, with a passion for basketball, spelling, and science. This summer, you may recall, Zayla made history when she correctly spelled the word Mireya, becoming the first Black American to win the Scripps National Spelling Bee in its 93-year history. After the contest, Zayla was interviewed by countless news outlets from all over the world. Many of them asked, many of them wanted to know the same thing. What on earth does Zayla Avant-Garde want to be when she grows up? So she answered the question the way any teenager would. She wanted to be a basketball player at Harvard and then in the WNBA. And she wanted to be a coach in the NBA. And she wanted to be a researcher at NASA. And she wanted to be a scientist curing diseases with CRISPR technology. I hope when all is said and done, when the technology has been built, the policies have been passed, and the devices have been programmed, that it's all been done with young people like Zayla in mind. I hope that when we make progress in our work, that every young person will look upon the world as Zayla does and see it not for its limits, but for its abundance. That they will not be encumbered by the weight of an unequal past or an inequitable present, but buoyed by a boundless future. And when they dream of a life in science and innovation, that they will see a well-trodden pathway, many well-trodden pathways to get them there, many on-ramps, many bridges. This is the work and the vision of the Biden-Harris administration. A STEM workforce that reflects all of us, from the classroom to the boardroom, to the operating room, to the laboratory. A public that is engaged in the everyday work of government and sees their needs addressed in our decisions. An approach to innovation that is rooted in inclusion, integrity, and our common humanity. We have before us an extraordinary window of opportunity, a chance to take the peril of this moment and turn it into promise and possibility. A chance to write a new social contract between government and the American people, and more generally, not just for this moment, but for the decades and generations that lie ahead. I thank you for the role that each of you are playing in this work, and I look forward to our further discussion today. Thank you very much.
So thank you, Dr. Nelson, for those important comments and a glimpse into some of the efforts and activities within the Office of Science, Technology, and Policy. So what I would like to do, we received some questions at the time of registration, and I would like to just to have a conversation about three different areas. One is related to STEM equity that you brought up in your comments, clearly issues around technology and science, and then your work as a social scientist at the Office of Science, Technology, and Policy. So the first question that we have is, at NIH, we recognize that advancing health equity in biomedical and genomics research requires us to foster a diverse workforce. And we are working to build a scientific workforce that looks like America and serves all Americans. I know OSTP is too. Could you tell us more about these efforts?
I'm sorry, Vince. I'm sorry. Could you say that again?
Yeah,
The audio cut out a little bit.
Okay, I'm sorry. So could you tell us a little bit about the efforts at OSTP that are focused on STEM equity and enhancing diversity of the scientific workforce?
Yes, so we're kind of midstream in that work. And we, as I mentioned, we started the Time Is Now initiative and are very much trying to think of a kind of action plan and a kind of strategy that would be galvanizing for the nation around STEM equity issues. We very much are taking an ecosystem approach that is not only about producing future Nobel laureates, although we want to do lots of that, but really is taking, a perspective that travels from, K to 12 to the skilled technical workforce, and really trying to take seriously, that STEM opportunities, and work and education, if people want it, should really be available to all people. And that there should be lots of ways in one's life to sort of travel, not in a pipeline. I think we've all learned no longer to use that kind of pipeline metaphor, but kind of that there should be, as I said, bridges, on-ramps and off-ramps to doing our work. And so, so we're trying to think about how to do that. How do we think about a national strategy from the perspective of, the White House that can sort of take in that whole journey? We've also been actually really listening to people. So it's clear that there are changes in institutional culture there. We want to think about, have a conversation, I think, about funding and about who we fund. And so much of our work in the STEM fields is really about weeding people out. So if you think about intro levels, organic chemistry, if you don't pass organic chemistry, you can't go to medical school. And, in the course of creating that weeding out culture, we leave a lot of people out who have a lot of talent. And, arguably in a generation, almost every job will be a STEM job in some capacity. And we need to have a new orientation that's not a culture of weeding out, but a culture of drawing people in. And that's bringing them into curriculum, into the classroom, but it's also changing the culture of institutions so that people fundamentally feel included. I'm very much an admirer of the Unite initiative that you and others have been working on, because it really takes into account many different levels. It takes into account grant making. It takes into account the institutional structure of NIH, of the institution you sit in. It takes into account history and the like. And so that kind of, we're trying to, I think, with you and others in government, think about a comprehensive kind of ecosystem approach to STEM equity. So we're still midstream, but we will have, I would say, in calendar year 22, a kind of action plan that we will love to share with you at that time.
Okay, great, thank you. So I'm moving and kind of following up on technology, emerging technologies, and the work that's going on within the office. So can you talk about the proposed Bill of Rights for an Automated Society?
Sure, yeah, we're excited about that. So this is a policy planning process that launched on October 8th with an op-ed that myself and Eric Lander wrote and Wired. And it was I think really responding to what we had been hearing since we'd come into office at OSTP from the American public, a real sense of frustration around our inability to have sort of rules of the road and guardrails around new technologies. And I think, 5 years ago or even 10 years ago, something like AI and machine learning was so abstract to the American public that I don't know that you could have meaningfully had, kind of public engagement around the issue. You really probably could have only talked to a handful of experts. But it is now the case that people are really quite aware that there's artificial intelligence in their computer screens, on their telephones. They're also quite aware that, unfortunately, there's, reporting on cases where it goes horribly wrong, and where it not only sort of repeats stories of inequality that we are quite familiar with, it shows how deeply they can be compounded and exacerbated. And so, Eric and I thought it, and the team here, that it was well past time to have that conversation. And also that it was past time. I mean, many of our organizations are, our institutions, many organizations in government and in private industry and academia have created principles around, and sort of ethics, so let's say, around AI and around machine learning. But over the last few years, we've seen that they've not been always sort of robust enough to sort of keep things from happening again and again. And so by going back to the beginning, this Bill of Rights conceit really is like, what are the foundational rights that each of us should have as members of the American public? And how do we learn to think about how those extend into the digital space? So, I think part of what we're also trying to do is open up a public conversation that says the rights that we've always had, those foundational rights and the ones that followed the 14th, 15th Amendment and the like, don't disappear when we bring on new technologies online. So you will have seen, this happened as well with genetics. There's a new technology, and some of us, I think, initially think, oh, well, we need new rules. Do we need new ethics? Do we need new policies? Do we need all the new things? And sometimes things are so new that we really do need to think anew about social structures and regulations and policies. But I think there's also something about just going back to the beginning and saying, we have these fundamental rights, and those rights should prevail even as the sort of tumultuous and sort of quick churn of new and emerging technologies is happening.
Great, thank you.
So let me just add, so we hope to have an output, a Bill of Rights document that we will have engaged with the American public, members of federal scientists and colleagues in government, industry, academic research, and the like.
Great, thank you. So to follow up on that and really kind of focusing in from a biomedical research and NIH perspective, how do you anticipate AI being used in the clinical settings for diagnostics and therapeutic uses? And what are the challenges and our challenges as researchers at NIH in thinking about that work?
Yes, that's really, it's a tough one. On the one hand, we do need to do things like make equitable data available in the genomic space and elsewhere. I think that the pandemic has shown us that we need to move to a place where we can have, electronic health records and figure out a privacy preserving way to do that in a way that truly benefits people. But because we have had, in the US healthcare system, so much discrimination, any data that comes out of the past is always going to bring that with it. And so there is this kind of fundamental problem because so many of the algorithms work by proxy. So what is a proxy for the thing that we are trying to, solve, cure, identify in this moment? Those proxies require us to go back to old data, and those old data, bear, the sort of discrimination and the constraints of the past with them. That's true of all data sets, even if you had the most, wonderful representative data set, but particularly given the history that we know really well of racial discrimination, for example, in the US healthcare system, it's particularly pronounced there. So I think that's just a a fundamental challenge to using data-driven automated tools and healthcare and clinical research that we just have to be honest about, and I think be thinking about. The other piece of this that we've seen in some really important papers by Ziad Obermeyer and others are just the problem, and Vince, you've written about some of this with, quote unquote, race correction. The ways that this historical data is built into medical diagnostic technologies and tools that we have been using literally for decades, for generations, and have never really thought about it. So, the upside of some of the challenges or the controversies that we're having about AI and machine learning, I think, is that we are learning, certainly as communities of scientific and social scientific researchers, to ask questions about these tools, but that also, I think, the larger public is learning to ask questions about tools that we have used in everyday life for a very long time, and the kind of to open up, as we'd say in science and technology studies, to really open up the black box and think about what that means. And that really is to the good, even though, it's always dispiriting to uncover discrimination, built into sort of the tools and technologies we use by design.
Great. So one last question, and this is really you as a social scientist in the Office of Science, Technology, and Policy. When the history books are written, what do you hope to have accomplished during your work at OSTP, and what legacy do you hope to leave behind?
Oh, gosh, what a question. I think one I would say, and, I'm so just pleased and honored every day to do this work and to work with Eric, and have been called to work with Eric by him and the president. I mean, one thing is really just thinking about equity in the center of science and technology policymaking. I just think that it was the kind of we've come into this perfect storm of the climate crisis, of a racial reckoning, of, a pandemic sort of raging all around us, that really forced us to say, we can't be an OSTP like OSTP would have proceeded 15 years ago or 20 years ago or 25 years ago. Like you can't go into science and technology policymaking without thinking about all of the inequality that has been, highlighted, all of the inequity. And so I think one of the legacies is, I hope, a science and technology policy office in the White House that is really taking up the social implications and complications of science and technology, and that is putting equity at the center of it. I hope if we succeed that we will drive a new and advance some real gains and the sort of STEM ecosystem space, that we will help to, I think, create new infrastructures, new ideas, new partnerships, and really to expand our thinking about the STEM fields, as I suggested before, as something that's for the few, as opposed to something that's for the many. And, part of what we've been doing in the Time Is Now initiative is also really talking to community groups, and that science is about curiosity and discovery, and that is not just a legacy for some. And so I think we really need to have, very much a small d democratic transformation in how we think about who science and technology is for, who it's supposed to benefit. So that's a legacy as well. And then, I am really proud. I mean, during Eric's confirmation hearing, he said he wants to build an OSTP that looks like America. We have historically, broken historic records on diversity and inclusion in OSTP. It is a truly diverse office, and I think, and we know that makes our policy work better. We have more different voices, perspectives at the table. So part of the legacy will be that we really that we're an OSTP that looks like America. Great.
So again, thank you, Dr. Nelson, for joining us this afternoon and being part of this lecture series. We really are honored to have you, and look forward to working with you. And I know my colleagues across NIH and FDA and researchers across the country that have been listening in are really interested in watching what happens at OSTP over the next few years. So thank you very much.
Thank you for having me.